Coming up now is Assemblyman Richard Gottfried.
Hi.
He's the chair of the Health Committee, longtime, maybe the oldest member of the legislature, if I'm not mistaken.
Well, I'm the most senior member of the Assembly.
Right.
Longest serving Assembly member, actually, in the history of the state. And I've chaired the Health Committee since May of 1987. So I've been at it a while. Almost got the hang of it.
Sure. And what do you expect this session, especially when it comes to health care issues?
Well, one issue that I know is on everyone's mind at this point is the medical marijuana issue. I think it is just very exciting that Governor Cuomo has put his stature in support of the proposition that there is legitimate, important medical use for marijuana for patients with very serious health conditions. What he is going to be doing by executive order, I think, is a very important interim step that he can do with existing law, although that law from 1980 is very limited and very cumbersome. Senator Diane Savino, who is the Senate sponsor of the bill that I've been carrying, she and I have been talking with the governor's office, and I would say that we are very hopeful that this legislative session we will be able to work out a comprehensive and strong piece of legislation that hopefully the governor will support. And I think with his support, I think enacting it is almost a sure thing.
Do you think this is the right path, though, to start out incrementally and see how it works? The governor pitched it that way.
First of all, we've had experimentation with how to do it in 20 states. Our legislation reflects lessons that we have learned from all of those states. I don't think New York needs to try to reinvent that wheel. I think the interim step that the governor is taking is important because it can be begun to be implemented now without waiting for legislation. But very clearly, the 1980 law does not enable us to, I mean, there will be tens of thousands of patients who ought to be able to have access to medical marijuana who will not under the 1980 law. And I think the governor's staff understands that, and so I hope we will be able to work out a comprehensive bill this session.
And you've also been a longtime proponent of a single-payer health care system. I believe you've introduced that bill every year for quite some time.
Yes.
Will you be introducing that, and do you think it has a real prospect for passage this year?
Well, you're right. I have been sponsoring a state single-payer bill for a long, long time. I am hopeful that we may be able to get that bill to the Assembly floor this year for a vote. If we get it to the floor, I think it will pass. What gives me optimism at this point is really bad news. You know, with the Affordable Care Act, I think we have gone about as far as we can go to try to make the insurance-based system workable for people. We are finding that you still have outrageously high deductibles and copays and restrictions on what doctor you can go to, and employers who more than ever are going to be dropping health coverage and putting their workers at the mercy of the marketplace where they have no negotiating power at all. I think it is becoming more and more clear to people that if you want to deal with those issues, if you want to deal with the financial burden on working families and the restrictions that insurance companies impose, you've got to go to a single-payer system. You know, the traditional Medicare product that was invented in 1965 has been justifiably one of the most enormously popular things, left, right, and center, that this country has. And, you know, the President Obama said a year or so ago that no American should have to live at the mercy, no American in their golden years should have to live at the mercy of an insurance company. I would say, why do we have to wait for our golden years to not have to live at the mercy of an insurance company? And I think more and more people are coming to recognize that because the Affordable Care Act has done, I think, what you can do. But, there's a Chinese expression that says you cannot carve rotten wood. There's a limit to what you can do with an insurance-based system, and I think we've seen that.
Sure. Assemblyman Richard Gottfried, thanks for joining us this evening.
Okay, thank you.